There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question: I have hypertension. What is the best way to lower my blood pressure? Answer by Bruce McFarland. In short, the best way is the way that is effective at reaching the goal of normal blood pressure, BP. In your case, the normal BP goal is 120/80 or less, without becoming symptomatic from being too low. Readings are taken in the same situation, time of day, state of hydration, nutrition and stress. Using the method of seated with feet on ground and back against chair back, in the same arm, as it lightly rests on the table or arm of the chair. Then, a reading between 120 to 140, systolic and 80 to 90, diastolic, is indicative that change is needed. Start with lifestyle, if not already doing that. Weight loss, routine exercise, moderating alcohol, quitting drugs and tobacco, restricting salt to 2000 mg/day or less, and being relaxed and stress-free are what lifestyle changes means. You can't fix genetics, so some people have hypertension, even when they've corrected lifestyle changes. Other people have waited so long to adopt lifestyle changes, that blood pressure elevation is too high to wait for behavior alone to create change. Medication is then necessary. A useful way to remember the level of BP that is too high is, add the two numbers, systolic plus diastolic. If the total is greater than 200, then treat with lifestyle changes, unless the total is greater than 220. Then go on prescription medicine. Prescriptions come in several forms. Generally, each different kind can lower systolic pressure by 10 to 15 mm Hg. A word about blood pressure readings. Hg are units of millimeters of mercury. Since early blood pressure machines, non-digital, sphygmomanometers, use a column of mercury to test resistance transferred through the body to the mechanism as the inflated cuff gradually allowed constricted vessels to let blood flow re-establish. The first number is the SUM, D of the heartbeat, as heard through the stethoscope, over a constricted blood vessel. It's the power of the heart overcoming the compression of the arm cuff. Then, the second number is when the heartbeat is no longer heard as the cuff continues to be deflated. It represents the least pressure generated while hearts are filling up. Prior to the next cycle, returning to a discussion about medications. Since results can be expected while initiating treatment, theoretically a patient might need 3 different agents to reach a goal, if their starting point is 180/106, as an example. The rational approach is not to wait for an accidental stroke by taking one agent for a month, then adding another, then adding a third. Taking 3 extra months to reach goal. It's also critical to understand how a BP medicine's mechanism can complement or inhibit another medication. Finally, too many side effects, or too frequent doses in a day are going to irritate a patient and they may quit taking it. The same is true for expensive medicine. Some medicines to consider: the blood pressure is a silent killer. In the case of many millions, they are unaware that it is causing damage. By taking a measurement of the pressure exerted inside the circulatory system, we are determining the risk of several worst-case scenarios. Pulse pressure is the difference between systolic and diastolic readings. At first, hypertension will drive systolic numbers higher. 120/80 becomes 150/84. Later, LVH will ensue and higher diastolic filling pressure make the second number rise. 150/84 becomes 170/110. Finally, the aorta is overstretched. After years of high blood pressure and its capacitance to absorb blood pressure is diminished. The diastolic pressure drops as the aorta dilates and doesn't return to normal size. 170/110 becomes 170/50. The pulse pressure on these 3 readings, 66, 60 and 120, respectively, to illustrate the concept of widened pulse pressure for aortic aneurysm. The problem is people not staying on medicine, and doctors not correcting the problems that patients encounter. There are variables for many cases, which means treating blood pressure is not one size fits all. The best way to treat high blood pressure is by being persistent, and not ignoring the problem. Don't quit until the goal is reached. Answer by Melissa Lee Mergen. I would do everything within my power not to have to take medications for blood pressure. There are side effects to all drugs. One thing men are concerned about is having a healthy sex life, Some medications for blood pressure can affect this aspect in some individuals. If I were in your shoes, I'd start with diet and exercise. Not necessarily cutting back on everything but things high in salt. I would drink water as a primary beverage, cut out any soda or limit yourself to 1 glass in a day or week if that's something you consume a lot of. Limit alcohol consumption. If it's been a while since you've set foot in a gym, I'd spend a little money and hire a trainer because it'll force you to make the commitment. If you are paying someone, you are less likely to cancel or back out. Swimming is great exercise if you have pool access and it's not stressful on your joints. Find an activity that you enjoy, maybe start with walking your dog. If you don't have a dog, see if adopting a pet is right for you. They help reduce stress and improve life. If you are a smoker, the best thing to do is to quit. There are a lot of programs available, some of them are free. These are things that you can do relatively easily, not necessarily all at once, but just implement one change a week and commit to getting your health in control with the tools and resources that you have available. Best wishes for a healthful future. Lastly, sometimes you can be healthful and family history will still cause high BP. This increases risk for cardiac disease. I remember a patient who was optimally healthy. Looking at him, a marathon runner and avid exerciser. He was not overweight, but had high blood pressure for 20 years or more despite his commitment to exercise and eat healthful. He had open heart surgery because of the effect his hypertension had on his coronary arteries. This is not the norm, of course, but please seek help and make lifestyle changes. Answer by Noel Williams. As many of the people here said, first see your doctor and verify the cause of hypertension. Maybe it's a bad lifestyle, maybe it's another health issue, maybe it's hereditary. Check that with your doctor. If the issue is caused by a bad lifestyle, then simply change it. Diet. Get rid of that many carbs, fats, and sugar. Maybe you can also visit a nutrition to give you a dieting plan that fits your body and needs. Berkeley advises on these foods that lower high blood pressure. Additionally, and speaking from my own experience, I would advise you to also consider taking omega-3 since it's highly beneficial for the heart and normally our diets do. And he provide us with the optimal daily dose, 23 grams. Research of NCBI on effects of fish oil on blood pressure, effect of omega-3 fatty acids on blood pressure and serum lipids in continuous ambulatory peritoneal dialysis patients. Eva tried several brands and the one I like the most is Intelligent Labs fish oil, but feel free to do your own research and make a choice. I like it because of the high quality and the fact that unlike other subs it doesn't leave a fishy taste in my mouth. In any case, make sure the quality is high because there is a lot of bad stuff out there. Start doing exercise. No need to become a professional athlete, but make sure you daily do exercises or a sport you like, walking, running, cycling, swimming, etc. However, if the cause of your hypertension is more serious, then probably just taking omega-3 won't do and you'll need some medication prescribed by your doctor.